Hi, I'm Karnika, health coach and diabetes expert at Besugarfit. Today we will discuss about the complications of diabetes mellitus every diabetic must know. The efforts to get your diabetes under control are undoubtedly inevitable, considering the undesirable complications of diabetes mellitus. Every diabetic should be aware of complications of diabetes mellitus. Type 1 diabetes, often known as juvenile diabetes and insulin-dependent diabetes. This type of diabetes is a condition where the pancreas produces negligible or no insulin. Besides, some genetics and certain viruses usually are the type 1 diabetes causes. Its common symptoms include frequent urination, sudden onset of bedwetting in kids, increased thirst, weakness, and blurred vision. Type 1 diabetes complications. Complications of diabetes tend to be pretty severe, even life-threatening at times. Type 1 diabetes complications include increased risk of heart and blood vessel diseases such as coronary artery disease, heart attack, atherosclerosis or narrowing of arteries, and increased blood pressure. Nerve damage, neuropathy, causing numbness or tingling sensation usually starts from the tip of your legs. Kidney damage, nephropathy, causes kidney failure or irreversible kidney disease requiring dialysis. Eye damage, particularly to the retina of the eye, potentially causing blindness. Foot damage, risk of several foot complications, severe infections, which may even require leg amputation. Some common complications of type 2 diabetes include hypoglycemia, diabetic retinopathy, kidney diseases, and diabetic neuropathy. The tricky part is that these diabetes mellitus complications develop and progress very gradually, and you may not even notice them if you have diabetes for some time. Some common long-term or short-term diabetes mellitus type 2 complications include short-term complications. Short-term complications of type 2 diabetes include hypoglycemia, noted especially with insulin, occurs when your blood glucose level drops too low. It shows symptoms such as sweating, increased heartbeat, confusion, and anxiety. Hyperosmolar hyperglycemic nonketotic syndrome is a condition with extremely high blood glucose levels, which may even cause death. This syndrome usually occurs in sick and older people and presents exaggerated diabetes symptoms. Long-term diabetes complications. Long-term complications commonly include diabetic retinopathy. High blood glucose levels may cause cataracts or retinopathy, leading to loss of vision. Kidney disease, diabetic nephropathy. This may eventually result in impaired kidney function requiring dialysis or kidney transplant. Macrovascular problems. Long-term complication of type 2 diabetes includes damage to blood vessels because of consistently high blood sugar levels, commonly affecting the eyes, kidneys, and nerves. Diabetic neuropathy. The damage to blood vessels also damages the nerves, causing different types of neuropathies such as peripheral, proximal, autonomic, and focal. Severe breathing difficulties. The newborn babies may suffer from respiratory distress syndrome. Low blood sugar, hypoglycemia. Hypoglycemia may be observed during pregnancy or after delivery. High blood pressure. The risk of increased blood pressure is high in gestational diabetes. Preeclampsia. It is a serious complication characterized by very high blood pressure, which can risk the lives of both mom and baby. One of the common complications in diabetes mellitus is a diabetic foot related to several foot problems such as fungal infections, ulcers, corns, calluses, or warts. Diabetic foot ulcer complications may be allied with skin and bone infections. Even a small cut on the foot may cause infections. Increased infections in diabetes can be attributed to the compromised immune system and damaged blood or nerve vessels. Abscess. Occasionally, the infection penetrates the bone or tissue or creates a pocket of pus called an abscess. Gangrene. Diabetes impacts the blood vessels that supply blood to your fingers and toes. Impaired blood flow may cause the death of the tissue and may require the removal of the affected area or organ. Deformities. Damaged nerves may weaken your feet muscles, causing problems such as clawfoot, hematose, and prominent metatarsal heads. Amputation. Problems with blood vessels and nerves in diabetes reduce your sensation. This may cause your foot injury to go unnoticed until a severe infection results in an abscess and gangrene requiring amputation. Diabetes mellitus is a chronic condition differentiated by excess blood glucose levels. Type 1 and type 2 diabetes share symptoms such as excess thirst, frequent urination, and fatigue. Complications of diabetes mellitus include eye damage, kidney damage, diabetic neuropathy, and macrovascular problems. Besides, gestational diabetes and diabetic foot are associated with other detrimental complications.